Welcome to the Megan Claire Show. I'm a breast cancer survivor, patient advocate, and your host, Megan Claire Chase. I'm working with Ancora AI to help share their mission, which is to give unbiased and comprehensive information for patients to empower and bring vetted trials to all patients. Now, this is the second part of our two-part series about physical activity for patients, but this time for those in the survivorship stage, like moi, navigating post-treatment. Once again, I am thrilled to have the amazing Dr. Corinne Jordan back with us. Hi, Jordan. And for those who missed the first episode, make sure to go back and check that out. But Dr. Jordan is a board-certified general and trauma surgeon specializing in breast diseases. She's also an award-winning top doctor for women 4 years in a row. Impressive, right? So let's get started. Dr. Jordan, thanks so much for being here again.
Thanks for having me.
So why is it important to exercise while in recovery and in the survivorship stage?
Yeah, so exercise is really important in survivorship, specifically and especially if you've had a hormone positive or ER positive type of breast cancer. And the reason why is because most women in survivorship are on, especially if you've had a hormone positive breast cancer, are on an anti-hormone medication, sometimes for 5, sometimes 10 years. And that will decrease your risk of having a recurrent breast cancer by about 50%, 50. So that's pretty big. If you just were to do exercise, that will decrease your risk of a recurrence by 34%. So what is exercise? Exercise, we quote you as being somewhere between 7,000 to 10,000 steps every day of natural movement. And so we're advocating for those two things together. But you can see that by taking a medication, you reduce your risk of a recurrence by 50%. By adding also some exercise into that, another 34%. And so that's a huge impact. Not to mention it helps you deal with the side effects from these medications that we put you on and help you with mind-body processing, mind-body connection, which is also very important during survivorship. And help you sleep better, feel better, get you moving again. So you're helping to move through maybe some limitations or limited mobility from surgery.
Right.
All sorts of benefits there.
So, and speaking about difficulty possibly moving, what kind of body image issues do you see in your patients during this phase that is, slightly impacting them to do maybe the type of exercises and movement that they used to do before all of this?
So we have had a lot of women going through treatment that have completely new anatomy on the other end. And so it's new body, new you, a rebirth, so to speak. And now, just like, a young person learning to get their legs underneath them, you're essentially doing the same thing. You've been through war, you've got a new anatomy, new body, now for the rebirth and regrowth phase. And so trying to figure out how to make that body move through space is not always so easy, right? So you've got some limitations with, some new breast tissue or reconstruction. You may be dealing with limited mobility from an axillary dissection or lymph node sampling. You may be getting some porting or limited mobility in the shoulder where we've done those sorts of surgeries. And so really more movement, more often, more important. And the reason why is the more we can break up that scar tissue, you're less likely to be limited over the long course. So as we're seeing more of our premenopausal women with breast cancer, we're looking at, 40, 50 years of survivorship and movement that we need to make sure that you are able to do. And so if we don't want to limit you too early, so we want to make sure that you can do all the exercises and things you want to do for life.
And speaking of, premenopause, what about those that are like me, where we had to be medically induced into menopause, because of other issues and not responding to medication. And then all of a sudden it's like, what is this body? What is this weight gain? How do I work through this and get it off. Please tell me, Dr. Jordan.
So there is hope. Don't lose hope. It's a new body, and we need to figure out how to get you comfortable in that new body and get that moving. So no, it's not, we certainly do like to make it challenging for you, right? We have to put you through all the medications and then the surgeries, and we tell you to be active and lose weight, and then we give you a medication that makes you gain the weight. So it makes no sense, right?
Right.
Finding something that you enjoy doing so it's not one more onerous task to your day, and making sure that you've got people that will participate in that with you, your tribe to support you, and making sure that it's fun, that there is hope. And the sooner you can get little bits of movement packed into your day is helpful. So you think of it like little exercise snacks. You get 15 minutes here, 20 minutes there, and every little bit counts and every little bit adds up by the end of the day.
Yeah, I really love how you said that, like just in little bits, because again, I think so many of us, we just feel like, oh my gosh, we've got to just go hardcore warp speed. We got to do it every day for like hours. And in fact, in reality, it's never going to work. Setting yourself up for failure. And I like that, taking it down into little snack sizes, little bite sizes, because Lord, we want to eat when we're in this forced menopause. I'm telling you.
Yeah, so the treadmill can continue just to hold your laundry as long as you're taking, little snacks here and there, going up and down the stairs if you can, little walks around the neighborhood after dinner. Every little bit counts.
Love that. So aside from like the whole menopause thing, or some of the women and men, where they have ongoing fatigue and ongoing issues, where it becomes, they have chronic pain. How can they overcome this through exercise without feeling like they're adding additional hurt to themselves?
Yep, the first step is usually the biggest step, and finding something that makes you feel good rather than just trying to motor through something to check the box is really important. So if you're dealing and struggling with a lot of joint pain, weight-based movements are not going to be the greatest for you. So looking at things that are essentially weightless. So getting in the pool, doing some water aerobics, simply just getting in the pool and walking laps up and down along the shallow end of a pool is really helpful, because it gets the joints moving, it gets the body moving, and it breaks up some of that scar tissue that you may be having after surgery or treatment. A lot of the anti-hormone therapy pills that we have can have some long bone pain as being the side effects. And so that's where the water aerobics, water movements, and yoga or Pilates really come in helpful, because they are just body weight movements at the most. So it's nothing really intense. You get all the benefits and the long-term benefits. Plus, they can be meditative, those movements. And when you can get into a state of meditation, sometimes that is also very effective at helping with chronic fatigue and pain management.
Like, I have a pool, but everyone, if y'all don't have a pool, maybe try your YMCA. And also to not feel embarrassed for those that, like, because I've heard this before with like aquatic, exercising, and to just not feel self-conscious, in the bathing suit, because I think that's what kind of turns a lot of people off, because we hear that we should do that, especially those of us that are in pain, is to get in that water, but also realize this is going to help us. So just do it. Just do it, y'all. So what do you say? I know, I'm a nut.
No, I love it.
So what if someone has never been a gym bunny, never like going to the gym, has never even like stepped into a gym? How can they get started, whether it be at home, or they're one of those where they don't want to be at home, they need to be around other people to stay motivated?
Mm-hmm. Two things there. Number one, with a post-COVID or in COVID world that we have, there is so much content at your fingertips that you can stream for free in the privacy of your own home. I mean, if we can do these Zoom meetings and interviews with no pants on, You can do, an accessible yoga and tap out halfway through, streaming the content on YouTube, wherever you can find it. Those are options there. So the content is there for you, you just have to find it. Number two, I would say, if you need the motivation, call in your tribe, call in some of those people that while you were going through treatment didn't know how to access or help you, or wanted to be helpful but just didn't know what to do. This is their moment now to shine, because they can go with you to the gym, help you get checked in. They can come with you to the Y. They can get in the pool with you. They can distract you from all the what if monsters that are eating away at your mind, and have a conversation with them, or just the very fact that they're there with you, going through it with you, is helpful. So calling your tribe.
Everyone to have that tribe. Well, as we wrap up, Dr. Jordan, what is some sage advice that you can give to patients in the survivorship stage who are, still struggling with that severe fatigue? Like, what are some things that maybe they can think even mentally to get themselves to, find something online and reach out to their tribe?
Yep. Set your goals as being small and attainable. Every little bit counts. So little exercise snacks here and there are really important. Give yourself some space to recover. You've been through an awful experience. You've been through a trauma. Give yourself some space and grace to heal and recover. All of those times that you spent in the doctor's office and going to appointments and all that is going to be gone for the most part now. So you're going to be there with a lot of empty time to fill, because that part-time job is over. So fill it with something that makes you feel good. Find what feels good and do it.
Love it. Love it. Well, thank you so much for, again, taking time to talk with us and really help motivate us, but also really hearing your patients, and therefore I feel heard right now, understanding that it has definitely been a trauma to the body, but to not give up on that body and to still work and move.
Absolutely. Thank you for having me.
All right, everyone. Make sure to check out the resources on Ancora AI by going to Ancora.ai, where they humanize clinical trials. Next week, we'll be back at it with Dr. Brian talking about what to do once you've found a clinical trial and that whole process. As always, if you have any questions you want us to cover or something in particular, leave a comment. And don't forget, subscribe to our channel and catch up on some previous episodes. I'm Megan Claire Chase. And remember, the more you know, the more empowered you will be.